So, one of the things that we want our residents to be prepared for is complex cases. Fortunately, we do see complications very rarely, fortunately. But obviously, we want to be prepared, and we want them to be prepared for any complications. And we do see a lot of complex cases in the OR. We we draw patients from a geographic and sort of socioeconomic catchment, and so we're doing all kinds of complex cases all the time. So this I&I format is really good for allowing us to really give a intensive experience, sort of focusing on a particular topic for a few hours, and it's basically like going to a course, and we're able to combine didactics, lectures and videos, along with the hands-on experience, which is really the core part of it, as well as being able to do some discussions as well, case discussions, for example.
The best thing about the sessions, I think, is it just gives the residents sort of an overview of what retina surgery is about. I mean, when you start your vitrectomy or scleral buckle, but you don't really know what it is, it's usually, in many places, it's reserved for fellows and not so much for residents. And the nice thing at Messian here is the residents get introduced to the techniques of retina surgery, both in the wet lab and also in the operating room. So I think that's one of the strengths of it. We also have a lot of faculty members who participate, and I think there's a lot of enthusiasm both from the students and from the faculty. So I think it's a great session.
Residents today get to do less and less suturing because of the cataract surgery. Sometimes it's not even one suture is required. So what I have found in the last 10 years is that a fellow who shows up on the first day of their fellowship, they can, within 3-6 months, do a beautiful peel of the macula. But when time comes to close that little sclerotomy, they drive me nuts because they don't know how to suture. So it is my utmost goal is to at least our residents will never leave their residency program without knowing how to suture. So suturing is extremely important, and so I use the excuse of scleral buckle, showing them how to suture the sclera as a way to learn how to suture. And it's the same technique, when you have to close a corneal wound, a sclerotomy, it's just the same, how you hold the needle holder, and how to be gentle on the suture, and minimal pulling, and use your fingers and not your wrists and biceps. And so I find that this wet lab is really to go over some defined suturing techniques that I want the residents to have put that in their head. And then we're always there for them. I know, like my colleague Young is very generous in giving very fixed times throughout the week. Every week, as long as the residents are willing, we're there for them to spend half an hour, just watch them suture.